Hello, Myers Park United Methodist Church family. Thank you for joining us today for this very important information session on Medicare D open enrollment. Medicare D open enrollment runs each year in the fall. It runs from October 15th through December 7th of 2020. And so this is a great information session for you to get some great details from two experts about Medicare D and the prescription drug coverage through Medicare. So I'm very grateful to have Jan Nomina, one of our church members, a retired CPA, and Ron Knapp, a retired institutional investment professional, both joining us today. Both have served as SHIP counselors, and that is the Seniors Health Insurance Information Program, Seniors Health Insurance Information Program. And their training is directed by the North Carolina Department of Insurance. They have done a lot of wonderful volunteer time in this capacity throughout the years, and we're very grateful to both of them. And they have also referenced that the Shepherd Center is continuing to do individual consultations and counseling related to SHIP and Medicare D enrollment as well. So I wanted to make everyone aware of that and also encourage you to connect with the Shepherd Center as well. So with all of that information, I will go ahead and let you know this session will probably run for approximately 35 to 45 minutes as Jan and Ron both present great information to us about Medicare D and what we need to know this year. So with all that said, I'm going to go ahead and turn this over to Ron. And again, thanks to both of you for being here today.
Mm-hmm. Thank you, Lauren, and I want to add my thanks to Craig Fisher and Jim Deal, our amazing multimedia team, for making this recording possible. And hello, Myers Park family. In fact, while I'm acknowledging other people, let me quickly acknowledge as well Carmen Rivera, who year in and year out does a wonderful job of scheduling appointments, which this year, unfortunately, we're not going to be able to do given the COVID situation. Two other acknowledgments I would like to make, and that would be to recognize Bill Spear and Nick Beard. They were legendary. Jan and I started working with them in the church library on making appointments for Medicare counseling. But they really pioneered the idea of volunteering and helping people through the confusion of Medicare. So I want to give those two a shout out and let them know we miss them. Okay, that said, open enrollment period, AKA OEP. It is, as Lauren said, it runs from October 15th through December 7th. Some sure signs that we're in OEP, if you've missed them, would include your mailbox being chock-a-block full of fancy flyers promoting various plans, telemarketers trying to assault your phone, and Joe Namath in the background pitching his Medicare Advantage plan in the safety of his home for free. So those are good signs of what is really, in all seriousness, a very important time for Medicare beneficiaries. The days of open enrollment period really are a great opportunity for Medicare beneficiaries to really kind of take account of their current plan, how well it's working for them, what it's costing, to review that plan and be prepared to make any changes before the December 7th deadline in the event that they feel changing to a different plan or an entirely different kind of coverage would be warranted. And that's what we'll hope to help you with. Before we turn it over to Jan and specifically our focus today, which is the so-called Part D, as in David, prescription drug plan. Drug coverage is also provided through a form other than the Part D, and this creates confusion for people. It's also provided through what is called a Medicare Advantage plan. That's under Part C of Medicare. Medicare Advantage plans are essentially kind of everything rolled into one plan. So it combines hospital, medical, in most cases, pharmacy or the drug plan and oftentimes some ancillary benefits like vision and dental. When we look at Part D today through Jan's screenshots of Medicare.gov, we're going to really focus on exactly what plan might best fit your need. And that is going to be a function of, how the plan is, what the cost implications are to you, what the convenience is, because these plans generally have networks of pharmacies and oftentimes offer mail order. The analysis that the Medicare.gov tool can help you with is really quite remarkable. And I think with a little guidance from Jan, as we turn it over here shortly, it'll become clear to you that it's a good tool to use. The idea of looking at your plan, let me leave you with a couple of caveats. One, don't assume that because the plan that you presently have was the best plan that you had for the year 2019, for 2020. Don't assume that that plan automatically will just be the best plan for you to renew in 2021. Virtually every year, prescription drug plans change. They change their formulary, or the kinds of the drugs that they offer and cover. They change their pricing. And so it's important to really take a good look at that and see whether you want to continue with that plan or switch to another one, which you can do without penalty in the open enrollment period. The other assumption is some people assume that if they are no longer taking a drug or had enrolled in a plan previously and still don't take drugs, then it might be a good time just to not be covered under a Part D prescription drug plan. While you have the option to do that, it's important to know that if you drop out and you try to come back in at a later point, there's a lifetime penalty. We won't go into the formula, but there's a lifetime penalty imposed by Medicare. So it's important really to, continue to renew your plan from year to year, whether you are currently taking drugs or not. So I think I'll end with those caveats, and Jan is going to show you how to navigate the Medicare.gov website. So I'm going to turn it over to her. Jan?
Thank you, Ron. The first action that you want to take is to get out your medicine bottles, ensuring that you have all the meds that you take. It's also a good idea. You can even check with your pharmacist, with your doctor, get a printout of the prescriptions, the dosages, noting whether you're taking a brand or a generic. And your next action is to get on your computer and go to Medicare.gov. You'll see this on the first screen. You have two options in searching for a new plan. One is to use your personal Medicare.gov account, which is on the right-hand side of that red circle. Log in and do the search here. If you don't have a Medicare.gov account, this is where you can click on log in and create an account. An advantage to having that account is really multifold. One is that the account populates with drugs you've used in your current plan. You can also have the option of deleting drugs that maybe you're no longer taking, adding drugs before you actually do your search. Also, in this personal portal, you can get your Medicare summaries electronically. You'll get an email each time a summary is posted. We are not going to work through that personal portal, but it is recommended that if you're a little bit computer savvy or just a tiny bit, that you go ahead and create your account. What we're going to focus on is that left-hand side, Preview 2021 Health and Drug Plans. This is a generic search on the assumption that you don't have a Medicare.gov account or don't want to create one. So if you click on that Preview 2021 Health and Drug Plans, You'll then see this screen. And where you want to do is click on Continue without logging in. They're again giving you that choice to create your own portal. On the next screen, you will see the second button to indicate that you are searching for a drug plan. You then enter your zip code and you hit Continue. The following screen shows the lower part of the form asking if you want to get help from Medicaid, low-income programs, Medicare Savings programs. Generally, you should select I don't get help from any of these programs. That's that last button. Then you would select Next. Assuming that you take at least one drug, you should select Next or Yes on the next form. Yes, I want to see drug costs when I compare plans. Then you'll indicate how you normally fill your prescriptions, retail, mail order, or both. Then you click on Next. The following screen is where you begin to enter your prescription information. You'll see on the right-hand side where I've tried to give you some hints as to what you'll be doing. Once you start typing in a prescription name, the system will try to automatically fill. You select the correct drug and then click on Add Drug. A drop-down will appear with various dosages, so you need to select the correct one and how often you refill it. For example, if you take a medication twice a day and refill it once a month, you would enter 60 and select every month, or as very common, 30 and every month. But it might be that it's 90 and every 3 months. Those are all options. Then finish with that button, the green button that says Add to my drug list. You then have the option to continue adding more drugs. For purposes of our presentation, I've added 4 commonly prescribed medications: lisinopril, metformin, simvastatin, and omeprazole. At any time, you can see that you have the option to edit or remove drugs. When you're done, you click on Done Adding Drugs. On the next screen is where you choose your desired pharmacy. Your zip code automatically pops up because you've entered it in other screens. You can then enter a pharmacy name for it to search, but there's also, based on, you'll see a filter there, distance. It defaults to 5 miles, but you can change that to 1, 10, and I think 25. There's a list of pharmacies within that range, and it's several pages. If you go to the bottom, scroll to the bottom of the page, you'll see that there may be 2 and 3 pages. And what you do is you put a click mark where it says Add Pharmacy. And make sure that if you're selecting a chain, that you select the correct CVS, Walgreens, or Harris Teeter, because there could be multiple of those within your area. On the next screen, you'll see at the bottom that I selected mail order and 2 other pharmacies. So you'll see that sort of in the middle and then at the bottom, because it shows your selections there in blue. On the next screen, you'll see the available prescription plans listed. If you're logged into your personal Medicare.gov account, your current plan and 2021 pricing will be listed at the top. This year, the system automatically sorts for the combined lowest premium and drug cost. But by selecting the drop down, you can sort by lowest premium cost or plan deductible. Finally, this year, there's a filter that allows you to select sorting by star rating, which each one of the companies gets a star rating based on Customer service and other things, you generally probably don't want to select a drug plan with a star rating under 3. And also preferred insurance carrier. If you only want to work with one carrier, you can just select that one. One of the very biggest additions this year is to select Insulin Savings over on the right-hand corner of the screen. If you use insulin for shots or in an insulin pump, this is a biggie this year, because then you'll only see plans that cover the max, that require a maximum $35 copay for a $30-day supply in all coverage phases. So instead of paying $150 for, say, a box of insulin or a box of pens, you will pay $35 per month copay. And not all plans have this insulin savings feature. You'll see on the next screen that I've selected 2 plans. You can see those at the bottom, the Silver Script, Smart RX, and the WellCare Wellness. These were the least expensive based on the premium and drug cost to compare. To compare, you then click the Compare button. On the following screen, you'll be at the beginning of the page that compares the 2 plans. They're listed side by side. First, you'll see the name of the plan, the premium, and the deductible. At any point, you can click on Plan Details to read more about that particular plan. Further down on this screen, on screen 13, the plans indicate whether your chosen pharmacies are standard or preferred in network. Let's see if we could look at the next screen. Thank you. You'll see there CVS preferred in network, Harris Teeter. But in the other plan, that WellCare one on the right, CVS is a standard in network, which more likely than not, the drugs cost more there if it's a standard versus a preferred. I selected the first plan, Silver Script by Aetna, that gives you the overview. Further down, you will see information about cost based on drug tiers and cost during each of the phases. So you'll see preferred generic, 0 copay, generic $19 copay, etc. The following screen shows you the selected pharmacies, their preferred status, if any, and the beginning of the cost during each phase of coverage. So for example, on this screen, you will see that I selected obviously very inexpensive drugs, so there's not much in the way of copays. The next screen shows what each drug will cost before that deductible's reached, cost after the deductible, cost in the coverage gap, and after the coverage gap. As I said, I chose generic low-cost drugs. Finally, this screen that you're seeing right now is a shot of the bottom of the detail page and reflects the drugs listed and any limits. Below that is the company's star rating and contact info, which you can't see. So these screenshots were done before actual enrollment began. So there's no button to show enroll here, but beginning tomorrow, 15th of October, you can actually enroll from the website if you desire. Alternatively, you can call the company's phone number, which will be listed with that plan information, and enroll over the telephone. Happy researching. Lauren?
Jan, thank you so much. I'm so grateful to both you and to Ron for sharing these great details about Medicare D and the prescription drug plans. As we all know, Medicare can be very complex, so learning these details and what's new this year is very helpful to all of all of our church family and those in the community who may have a chance to watch this. So I'm really grateful for your time. Your experience and insights really help all of us. Ron or Jan, any last thoughts or comments before we wrap things up today?
Lauren, yeah, let me just make two quick clarifications. I talked a little bit about Medicare Advantage plans and the fact that some people of our members, I'm sure listening or watching this, will get their drugs through a Medicare Advantage plan. Importantly, during the open enrollment period, you can move from a Medicare Advantage plan back to original Medicare and then buy a standalone prescription drug plan, as Jan just pointed out, through the Medicare.gov site. So it's important to know that you can make some major switches. You can also switch from original Medicare to a Medicare Advantage plan. But the point is, there are various options that you have, not just with respect to whether to stay with or to switch a prescription drug plan, but maybe even to switch your entire coverage from original Medicare to Medicare Advantage. One of the things that would come up frequently in our consultations in the library, a lot of our members have so-called Medicare Supplement or Medicare or Medigap plans. These are just to pick up out-of-pocket costs associated with Medicare, but they do not relate at all to prescription drugs. So it's important to know that Medicare supplement plans are not something that tends to be reviewed during open enrollment.
And one thing to note, I think, about Medicare Advantage plans, Ron, the one thing we caution people about is if they're on a Medicare Advantage plan and they decide they want to go back to original Medicare, is that, and they want to buy a supplement, there's underwriting. And so
yes,
that can be a negative. If you have health issues, then you may or may not be accepted in a supplement plan. You can always get the Medicare D, the prescription. So this is a little outside of today's discussion, but we just wanted to mention that. And
yep.
Lauren, were we going to make some availability for anything?
So with that, as Ron and Jan both indicated, sadly, because of the pandemic, our individual consultations are not really so much of an option, unfortunately, this year. And we're thinking of all of you and holding everyone in our prayers during this delicate season of pandemic and all the challenges it has created. If you do have further questions and would like to speak with Jan or Ron, there may be some very small opportunities we could connect on in that regard, but mindful of their time and their own schedules and how we would have to do a lot of that virtually this year, that poses some extra challenge. So I would encourage you to utilize the Medicare.gov site, as Jan and Ron both referenced. It's a great tool, and Jan, thank you for walking us through that. If you have questions, though, and would like to explore things further, feel free to reach out to myself at the church or to Carmen Rivera, and we can look at details with you further. I would also, again, reinforce the resource of the Shepherd Center here locally. They are, from my understanding, doing some individual consultations. I believe those are probably in a virtual capacity as well for now, or by phone. Again, we do have resources here in Mecklenburg County with that. We also have the North Carolina Department of Insurance website, has some great information on their page as well, as far as the SHIP program and SHIP counseling opportunities as far as individual consultations. So please be mindful of those resources as well, as we all journey through this pandemic together and look at different ways we need to connect and get information this year. With that, I will go ahead and close this and just again extend my great gratitude to Jan, to Ron. I know Ron had also mentioned a great deal of thanks to Craig, and we are grateful to Craig, to Jim, to Carmen for all of their help in organizing and keeping us connected media-wise and this great platform to present this information today. So to all of you, great thanks, and wishing all of you well. Take care.